Hello, everybody. So today we're gonna talk about ligaments and bursas and joints and that stuff. So pay attention. It's part 4. So let's go dive in. Come on. So as you can see, this is your trunk. Those are the ligaments. It's gonna be a very superficial video. I'm not gonna dive a lot on this because it will take a lot of time, and I don't wanna because I wanna start talking about training and exercising and that stuff. Don't wanna spend a lot of time on anatomy because it's a bunch of videos on that. So as you can see, this is a lot of ligaments. This is the knuckle ligaments. This is the interspinous ligaments. You know, our body is between every bone in your body. You'll find like ligaments between them. It's a lot of ligaments. As you can see, this is your anterior longitudinal ligament spine. This is your there is ligaments here too. Anterior sternoclavicular ligaments. There is ligaments here, bunch of ligaments in your here too, and obturator membrane here. You see here a lot of ligaments. This is your intervertebral disc, your annulus fibrosus. There is liquid inside there. As you know, you can't compress liquid. That's why when you compress that liquid, when you bend like this and you compress it, so liquid doesn't compress, so it start pushing on the annulus fibrosus here, and the liquid like pop out here, and it start pressing on the nerves coming here. That's how you feel pain and that stuff when you have a herniated disc. If you cut, like, if you take this L4 vertebrae and L5 vertebrae, because of the structure of your ligaments, it's not gonna fail, You're not gonna dislocate it. I mean, if you take those vertebrae here, this L4 and L5 under it here, and L5, L4, and L5. Without cutting the ligaments, your structure here will still stand up because of a phenomenon called tensegrity. That's how engineers figure it out how to make those beautiful big like bridges and that stuff with cables. So I want to show you this structure here. There is bunch of ligaments surrounding your shoulder joints to stabilize it and that stuff. That's why when you're doing behind neck exercises, it's not good for you because I should say that or no. It depends on the comments. If you ask me why it's not good to do those exercises behind the necks, I'll tell you why. Because of the ligaments here. There is a connection between the ligaments and why you shouldn't do. You can do that exercise time to time. It's not a big deal. It doesn't gonna like hurt you or anything. Time to time, but if you're doing it often, it's not good. It's for the reason here is the ligaments. And if you want know more, just comment down, I'll tell you. And those green tissues here, it's your bursa. It's like an oily tissue. It's not like that, but it make the movements smooth and the tissue to slide from each other because there is liquid and synovial liquid inside it, and it make it like it's like a cushion, and it make the movement the friction less friction. Okay, so the tissues slide on each other without a lot of friction. That's why when you move your joints, you don't feel like we're gonna take this bursa here, a bunch of them, you see them in different places like that. And this is your biceps tendon, and it has a bursa sheath, tubercular tendon sheath, and it's like bursa. It's like a bursa, but it's similar. It's not the same name, that's all. But the structure is very similar, like a bursa. So this is the biceps long head tendon. This one, and as you can see, there is a sheath surrounding it, and there is a tendon here, transverse ligament, to stabilize it so it doesn't like pop out or something. And I'll show you how to warm up this area here. It's important to keep your tendon from inflammations and that stuff. And now we're gonna take all those ligaments, we hide them, This tissue here, it's called labrum. This is glenoid labrum, and the labrum has a structure of. You see the when you touch an octopus or calamari, like that. The texture is not hard or very soft. It's like between them. So the texture is like very similar. And the main purpose of this tissue here, the labrum, to make your joint stable so it doesn't move, making it like as a socket, it stabilizes your joints so it doesn't like slide left and right, up and down, and it's messy, like a ring. To seal it in that place. You see what I mean? So the labrum here is, like I said, it's a tissue that is responsible of making your joints stable. And a lot of people, they screw it and it tears. The labrum is like your meniscus. If you heard about the meniscus in your knees, the labrum plays a meniscus role. It's similar. It's not the same way, but it's very similar. And the labrum here, in your hips joint or in your shoulder joints, it stabilizes. Just keep that in mind. And a lot of people, when they tear it or they have a tear in their labrum, it finish bad because you're gonna mess up their cartilage after that, okay? Because you're gonna have a lot of micro movement and your joint's gonna go bad. So it's good to keep your labrum safe, and there is ways to do that. So we're gonna go to the lower limbs. As you can see here, there is bunch of tendons too. We're gonna go to the hip. As you can see, this is the bursas, bunch of them. We're gonna take, as you can see, your joint is wrapped on tendons, the femur head. We're gonna take all that, we hide it, and this is your acetabular labrum. As you can see, gonna hide this. See, and a lot of people, they mess up their labrum and they finish with hip replacement. Why? Ask your favorite YouTuber. He'll tell you why. Those people preaching to going down and that stuff, and they don't know anything about the femur head structure. And keep in mind, not everybody have an acetabulum looking like this. Your acetabular, it's the shape. It's this area here. Some people, they have it deep. Some people, they don't have it deep. And even the shape of your femur head is not the same from person to person. That's why some people, like, they can't spread their legs like that, and some people know. And when you forcing, you just like forcing bone to bone, bone to bone, and then you screw in your labrum and you destabilizing your joints, and you're gonna have your cartilage, the cartilage, like hitting on the bone, and you're gonna mess it up, and it will finish with arthritis and that stuff, and it's gonna go bad. You're gonna finish with hip replacement. Why? Because your morphology doesn't allow you to, like, when you're doing press and you go and you feel like you are blocked here when you're doing leg presses, it's fine. Your morphology, if you go deeper, 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 and you're gonna force yourself, you're forcing on your labrum, brother. You're gonna, don't wanna curse, but you're gonna destroy your joint. You're gonna destroy your limbs, your hips. I'm telling you, you're gonna destroy your femur head, man. That's what's gonna happen to you. And everybody, they go in the gym as warriors, but they left it as, like, I don't want to say the word, but you see what I mean. I'm motivated and going like crazy. And you say, bro, chill, relax, calm down. Go lift some weight, keep yourself safe. If you don't feel comfortable going down a lot in a squat, and you feel like your hips is blocked, and that's it. That's how what your morphology allow you. The other guy, he have like a different shape of acetabulum and femur head, and he have more space so he can go deeper. But you don't. And if you trying to copy your neighbor, you're gonna screw up your labrum, and you're gonna finish with problems in your joints. So just be smart and stop listening to those people preaching stuff without even understanding nothing about human anatomy and nothing about pathologies and anything. They know nothing. They are pure ignorance. Pure ignorance. You aren't gonna become Tom Platz because you're going down. You aren't growing your legs, your muscle legs. You ain't gonna become Jay Cutler or Quadzilla or nothing because you just going more 12 millimeter more. No, nothing will happen. You're gonna have the same size. Just keep yourself safe, man. That piss me off. Seeing people, I swear, there is people they have hip replacement on their 30s, man. And you 30 years old, and you're like top of the top, and you screw yourself, finish like destroyed. Come on. That's why I'm showing you that. And don't think like I'm just saying that. I will show you the proofs later and I'll show you the research, the studies done about that and how they figure it out and how and I will show you the comparisons between human skeletons and this and that. I'll show you. Don't worry about it. Just listen what I'm telling you now, and I'll show you later. This is your knee. We're gonna hide all that stuff. This is the joint capsule of the knee, because even here and there is a capsule. You know, it's not that in this joint here or head of the femur. It doesn't show it in this model, but there is a capsule too. Okay. I'll show it in the picture here. We're gonna hide, so there is bunch of ligaments. As you can see, there is the crucified ligaments, posterior and the anterior is inside. You see it? This is your, where is it? Meniscus. You see it? This is the lateral meniscus and the medial meniscus. It's like the labrum in your shoulder and your hips, you know, and your femur head in the acetabulum. It plays the same role. It stabilizes your joint, so it doesn't allow it like to slide here and here and here. So it's like a stabilizer. It's like a cushion, you know. It make easy for your joints to be stable and in the good place where it should be. And keep in mind, these shapes here are different from person to person, and that's why we aren't the same, brother. We aren't the same. That's what you have to understand. The more you understand that, you more you kind preserve your body and don't destroy it. I want to show you this here too. There is bunch of burses here and here. I'm gonna show you some nerves. Okay, and this is how your nerves look. This is the main nerves. For example, this is the medial supraclavicular nerve. As you can see, there is bunch of nerves. Your nervous system is huge, it's everywhere. Actually, you can't contract your muscle without it. If you don't have impulses, they measure it with millihertz. So if you don't have an impulses going to you from your nerve system here, from your nerve here to your muscle, it's not gonna contract. And keep in mind the shape here. It's not like very accurate because this is the main nervous system, but there is like small other nerves going to fibers here and here, and the shape of it's different from person to person. Like I said in the first video, they call that the surgeon headache, and surgeon have to be careful and known, and they know about that. They study it and that stuff. So when they do their surgery, they have to be careful so they don't cut a nerve accidentally or something. So they take in consideration those differences from person to person. For example, this is your sciatic nerve, peroneal nerve. This is the tibial nerve. Oh, and this nerve here, it plays a huge role on if you can't touch your hands in the ground or no with when your leg are stiff. It plays a role on your in your flexibility, and you have bunch of sensors too in your ligaments. That's why you feel the weight getting heavier and heavier every repetition. I'll explain that to you later. Maybe people going, "Whoa, what are you talking about?" And you don't know, bro. You don't know. There is a lot of stuff you don't know. I'll explain that to you. Okay, don't worry about it. It's not. I'm not talking about sorcery or anything. I'll show you the studies and that stuff. Don't worry about that. Those videos are, like I said, just superficial and just to show you the main things, so you kind of start understanding a little bit. I told you it's just a superficial video to show you a little bit of things. I don't know if you want to see more about anatomy, just tell me in the comments if you don't. But I don't want to like go very deep in it. We aren't to try to become doctors or specialists, but it's general knowledge as a bodybuilder or as an athlete. So at least you know what you are doing to your body and how to properly exercise without harming your body, eh, or even when you're doing it, you're trying to minimize the harm. Okay, so see you to the next video. In the next video, I'm gonna start talking about exercising and how to do your structure your workouts and that stuff. It will be interesting, not like those boring videos. So see you in the next video. Okay, ciao, bye bye.